Welcome to the very first episode of Health Huddle, a space where I talk honestly and sometimes uncomfortably about what really shapes our health decisions. In this debut conversation, I sit down with Dr. Sarah Howcutt, the public health expert, researcher, and educator. Hello, everyone. It's podcast Health Huddle. Here we are speaking about health literacy, how to improve health communication. And today our guest is Sarah Howcutt, passionate public health educator. Thank you for this first episode, and we prepare some provocative questions. I hope it will be interesting for our listeners and for you as well.
Let's do it.
Why do you think that smart people choose unhealthy things and make this not right choices?
I love this question. I don't know whether you'd think I was smart. I'm a university lecturer, so some people would say I was smart. And I've done a lot of research about alcohol behaviours as an example. Do I drink alcohol? Yes, I do. And so why would that be? I know an awful lot about alcohol harms. I spend a lot of time reading and talking and teaching about that. Why do I still drink alcohol? Well, that's because it's more complicated than just knowing that we probably shouldn't do something or we should do less of something. And that's because there are a lot of things that motivate our behaviour. So, for example, I get to a Friday night, I have my glass of wine, I enjoy the taste of wine, and I get the pleasure of drinking that glass of wine now. The harms that I should be worrying about, things like increased risk of cancer and effect on my brain, those things are in the future. So I don't have to worry about those yet. But also, if you think about drinking a glass of wine, I'm often doing it with people I love spending time with. It's part of my social interaction, and we like to do things together. So if one person's drinking the glass of wine, I'm going to be more tempted to do it myself just to be part of the group. But also, it's habit. Friday night is wine time in my house, and that's our day of having a glass of wine and spending time together. So I get other gains, not just from drinking the glass of wine, but making that time to be with my husband and my family. So there's lots of motivations that actually make the information about the health harms feel a little bit quieter in the back of my mind. So it's more complicated than that. Information's important, and we're going to talk about that today, but we also have to remember that when we make decisions about something, there are a lot of factors at play.
Yeah, and it's completely understandable. It's human, and I think that our listeners will understand. Yes, of course, it's true. But how for us not to be banned by NHS or something for such kind of things? It's important to find a balance. So, and what do you think is important?
We have to find a balance. The information's really important, so it's very important that our health professionals and also people we trust in our communities, that could be our faith leaders, our public health lecturers, I used to teach you, Anna, didn't I? Put out messages about the risks and the harms and the good health behaviours and things we can do to change. That's really, really important, because that gives us motivation to change our behaviour. If we understand where there could be dangers, then we are more likely to want to change something. And also, information can give us the tools, so it can suggest how we might replace that glass of wine on a Friday night with something else that still enables us to have all the other benefits of spending time with others, etc. So health information is really, really important for that. But we also have to understand that when we make decisions driven by our culture, driven very much by the people we spend time with, and also about things like our identity. For some people, kind of being the person who's relaxed going out, that alcohol enables them to form that identity or be more confident, less inhibited with other people. So we need, as health promoters, to be thinking about the whole context in which somebody is making a decision. And we also have to be careful with our health information that we don't make people feel guilty. Because when we feel guilty, we do two things. We either run away, so we stop paying attention to that health information because it makes us feel awful, or we feel worse about ourselves. And when we feel worse about our ability to make a change, to be healthy, then we lose something that we call self-efficacy. Self-efficacy is really important when we want to change a behaviour or do something new. It's that belief that I can do it, that I can make a change that will have a positive benefit on my life. And so if we make people feel guilty through our health information, then we actually could be making it harder for people to make that change.
And this podcast is my way of making health make sense, especially for people who felt left out of the system. It's a project I'm building from scratch here in the UK as a solo mom of 5 from Ukraine, determined to fight health misinformation and open up real, useful conversation.
If we see our life as a whole picture, with all these social interactions and...
I mean, that's what I love about public health. So I was a psychologist before, so I trained as a psychologist. And psychology does think about the complexity of behaviour, don't get me wrong. But what I realised when I was working in psychology and then when I started to do research in public health, that people's lives are really, really complicated. So if we just focus on telling the individual what we want them to hear, they might not be listening to us. They might be resisting the information because they're not ready to change, they're not wanting to change, but also they may not be able to control something. So if you think about somebody at work and they go out for dinner with their work friends and their boss says, has a glass of wine, and they're trying really hard not to drink alcohol, but somebody with power over them in their workplace is telling them to do a behaviour. All of a sudden that decision making it's nothing to do with the information they have in their heads. Those social hierarchies are really important. And as a public health person, one of the things I always try and tell people is healthy behaviour is complicated, so we shouldn't feel that we need to blame ourselves if we're finding it hard, because there are a lot of factors, some of which we're not in control of. Yeah, there's a lot of literature, there's a lot of media at the moment about how doctors and health professionals of all kinds should be doing more to get on top of the nation's health. But actually, this is where health communication, it's also sitting within a society, and our consultation times are very short. But also, we know that when we do health communication, it's really important that we know how the message is going to be received. So if you think about it, if you're sitting on your phone, I know you're interested in digital technologies and communication. If you're sitting on your phone, you're scrolling through things really quickly, aren't you? What makes you pause and pay attention to something? That's really important for us to understand, particularly in this world where we have a lot more information being thrown at us. And healthcare professionals need to think about what makes people stop and pay attention. And we know from psychology that you're more likely to look at something and pay attention to it if it does the job for you that you want to do. So a lot of my research was using consumer psychology, so kind of how people sell us stuff we don't need, and how we do health communication. And one thing we found out from doing our research is if a message fits somebody's identity that they want to be, who they want to be, or it matches who they are now, so if they think that is for me, then they're more likely to stop and look at it. And so it's really difficult for our health professionals, for each patient or service user coming to them, to adapt the messaging in the right way, which is why I always argue that if we're going to do health communication, we need to be using lots of different avenues, and importantly, the communities that we want to reach with health messaging, they must be involved in creating it, because they have the right voice to make people sit up and say, yeah, that message is for me and I should be looking at that.
Yes. How can we build this system to use communities' voices, engagement more?
I think as a society we need to think about the value we place on health, and that's something that is being debated a lot, particularly now we're coming out of COVID, because during COVID I got very frustrated, you might have remembered, because there was a lot of talk about health versus wealth. And if we were going to prioritise health as a country, we would have less wealth because people would be staying at home and isolating and trying to stop the virus going, and that impacted on wealth. But in public health, we say that health and wealth go together, because if somebody is well, they're able to contribute to society. If they're not well, then they're going to become economically inactive, something we're very worried about in our societies at the moment. So we do need to take stock of what is important to us as a society, and public health funding all around the world is being squeezed because people are dealing with problems that are coming thick and fast at the moment. People are struggling, and so there's going to be less capacity to do community empowerment, because empowering communities takes time, as you've said. It takes money because you have to take a long time to build relationships and to work with people. It can be quite slow work. But I think it's really important because we know that if we are doing health throughout our community with everybody involved, then we've got the biggest chance of success.
If we talk about health literacy generally,
sure.
What ways do you see as examples, as case studies, what works?
Okay, well, let's talk about what health literacy is to start with, because some people watching and listening to this might not know. This is a very funny term. So health literacy is more than just being able to read or hear a message about health and understand the language in which it's written. It's about understanding the information so that you can use the information to make a decision about your behaviour and your choices. And health literacy, we know there was a great model in 2007 by some guys called Paasche-Orlow and Wolf, and in 2007 they said there's 3 ways that health literacy impacts on somebody's health outcomes. The first thing is it changes whether they take up health services or not. And that's really important today, where we're moving a lot of things online. Because if people have low levels of health literacy, they might not be able to navigate all our complicated systems. Even to make an appointment these days can involve technology, a lot of systems to follow. So if you've got low health literacy, people might not take up the help, even when our society is making it available. And we know that one of the reasons why 20 years ago we had these things called Sure Start centres that were in people's local communities that people could just walk into, and they put them in areas of greater need so that it reduced the barriers of having to navigate finding the right hospital, the right centre. You could just walk in, and that was to tackle one of the issues with lower health literacy. Second thing that health literacy does is it changes your interactions with healthcare professionals. So if you imagine kind of a very busy consultation, you have 7 to 10 minutes with your general practitioner these days. So the poor GP or nurse that you've gone to see doesn't have a long time to get to know what you need in terms of that health information. So they have to get the information out quite quickly, and you may not understand it. And you may also not know what you don't understand if you don't have good health literacy, so you might not ask the questions you actually need. And then we know that when people come away with the medication, we know that people with lower health literacy who've struggled with that interaction in the clinic then are more likely not to follow their medication pathway, and that can have huge problems, as you can imagine. And the third thing that health literacy is linked with, according to Paasche-Orlow and Wolf, is somebody's belief in themselves, their motivations. You know, if you think about it, if you think, well, there's absolutely no point me dieting because I'm never going to lose weight. I've tried before and it's never worked. So you can tell me I need to lose weight, you can give me the information about how I have risk, but I'm never going to manage to do it. And we know that people with lower health literacy actually feel less empowered in their society and their communities more generally, and we think that's linked to whether they adopt new behaviours that could make them healthier. So health literacy is really important for all of those things. So then the challenge for us as professionals working in this field, but also people in our communities who care about this stuff, is how do we get the messages to work for people in different communities? And I was recently doing a study where we were looking at how to increase the uptake of bowel cancer screening in South Asian communities in this local area, because we know that these people in older adults from South Asia are less likely to do this very important screening test. And we found out that actually the messages were not getting to the right people in the right way. And we found that actually if we understood what people needed, we could take the messaging out of those very rushed clinical settings and put them into places where people have got longer to absorb, but also if they're having the messages delivered by peers or people they trust, such as imams or other faith leaders, then they're more likely to ask those questions. Yeah. And they're more likely to think this information is for me. So the work I did, lots of people were saying, actually we do really want to know the statistics about the risks of cancer because we don't know that and it would change our thinking. But where are we going to get that? A leaflet at doctor's surgery? How about actually in community meetings, part of worship sessions, places where you're going to be and talking and comfortable because you're with people who share similar concerns but similar barriers in their lives as well. So I think if we're going to do health communication, we need to understand the people receiving the message a lot more and think about, are we the best people to give the message? And if not, how else could we make it meaningful but also give people the confidence to engage with the information or the chance to ask questions from people who understand them. So there's lots of things we could do, and it's not just in those clinics, so we all have a role to play.
Yes, it's a huge issue, and
it is a huge issue.
And yeah, hopefully in our Health Huddle we can be involved. And
I love it.
Because it's always lack of staff, of time, of resources, how to build the system.
But again, we don't have to confine health communication to these busy healthcare settings, or even be using champions' time when they have a lot to be doing. We've got digital technology. I mean, guilty pleasure here. This is all coming out today. Not only have I told you that I like a glass of wine, but I also love TikTok videos, because at the end of a day of reading and writing all day, I just want to watch something mindless for a little bit. And those are being made all of the time, and just think about the reach of those kind of videos. And we know in psychology that the most powerful messages about changing behaviour come from two things: either from somebody we admire and we would like to be like. So think about all of these influencers who are telling us what makeup to buy and what food to eat, and you know, the Dubai chocolate bar, all that kind of thing. What if we could leverage these people to do the health messaging? But also, if you think about messaging as well, if it comes from somebody who is like you. So when I was doing my research about health communication, I spent a lot of time listening to marketeers who created adverts, and I listened to a wonderful man called Paul Barden, and he was behind the Dove adverts, so kind of for soaps. And one thing he realised, instead of having wonderful models, kind of saying, have this shampoo, you will look as beautiful as me, because everyone was going, no chance, I know what my hair is like. Instead, they moved their adverts towards having women who look like normal women, just a little bit better. So you could almost imagine getting there. And we know in psychology that messages work really well if they're also delivered by somebody who we perceive to be similar to us. So you can use a doctor and that has that authority and credibility behind the message. But also we can be using people like us to do that messaging, and that can be really powerful. So I think that we need to branch out in our health communication now and use all of these technologies in more creative ways. Using the psychology of marketing is really useful, and I'd love to see more of that in public health.
Yes, digital marketing for all this. Yes,
Yeah.
Of course. And what is interesting, I absolutely agree about influencers and people who share their opinions, views on wider audience, and it's always problem with misinformation, I think.
You've hit upon a really important thing. Misinformation's really problematic, and it's something we need to think more about. So first of all, with information, we need to be teaching a lot more about how social media platforms work, how news outlets work, how media work, so that people can make informed decisions about what they want to follow. So I'm not saying we have to ban everything that's not true. I don't think that's possible. But just like when you were in class with me, I was always saying, I want to see critical thinking. I want you to question everything. I always used to say to my students, I want an ABC from you. I want you to ask questions all of the time. I want you to believe nothing when you first read it. And I want you to criticise everything. And so I always kind of teach my students, remember those ABCs, because the problem is with information is if it comes out for a platform such as this one even, it looks quite polished, particularly if you've got an expert who's talking, just like I am today. It sounds like it's something you should trust, and it's very easy to go, oh yeah. But actually if you stop and you think, how does that fit in the rest of my life? And you check what you've heard from lots of different sources. And you also understand a little bit more about the platforms and how they work, and the algorithms are really pushing information in a particular way. If you understand how all this works, then you're going to make good choices about where you check your facts. And I don't think that really we can say let's ban everything that we don't agree with, because that's another problem ethically for our societies, isn't it? But we can be teaching our families, and not just our children, our older adults as well, about how these things work. It's a bit like when I'm teaching my kids and my students about artificial intelligence. All of these tools are useful, but they're only going to be useful if we understand how they work and how they take us in good pathways and also in bad ones.
Yeah, critical thinking is really important, and the more creative we will be.
And that's what I see as our responsibility, is people who are looking at stuff and being critical. We need to be putting messages out, but we do need to think about the psychology of how people are attracted or turned off from information, so that when we put information out, it's likely to reach the people who actually need to engage with it. And I don't think we're doing that quite right yet.
Probably you can tell us more about what are you doing right now and what was done.
Well, I'm really interested actually in how we do research, because we can only create the right treatments, the right environment for good health, if we understand what people need. And one of the big problems we have in health research is that, have you done any research studies this week? No. No. I have. Why? Because I'm nosy. This is my life. I always want to look at other people's work. And because I'm interested in this stuff, I see the adverts for research and I take part in it and I give it my time, because it's really, really important. And that means that when you do research, you always get loads of a particular type of person. They're usually middle-aged. More often women. They quite often have high levels of education, and importantly with health research, they're quite often healthy people. Because if you think about it, none of us likes being asked questions about something we feel guilty about, do we? Okay. So if somebody's saying, can you answer questions about your drinking behaviour, your exercise, your smoking, your alcohol, if you are engaging these things and you kind of know you're not doing the right thing, you don't want somebody to ask questions about it. And what that means is that we end up only hearing from healthy people in our research. So then how do we know what the unhealthy people need in their lives to make those healthy decisions? So in my research, I took some marketing ideas about how advertisers sell products that people don't need. Because what I found in the research before my research was people assumed, researchers like me assumed, that health research was as important to participants in our studies as it was to us. And of course it's not. People have got busy lives, they've got stuff to do, they've got their kids, their family, their work, their hobbies, everything going on. They don't need to be doing the health research. But also, marketers are really successful at selling us products we don't need. Me, they can sell me shoes. I love shoes. I can buy shoes even when I don't need any more shoes. You were all checking my shoes out now, aren't you? I saw that. But how about if we use that psychology of how you get me to buy another pair of shoes when I don't need it, to take part in research? And so that's what I did. So I created a marketing approach to invite people to research, and that's been used now in lots of different types of research to get those people that we really want to hear about. And that's what I think is really important for health communication and for public health. Let's not just think about ourselves as one professional group, medics, nurses, public health people. We need to draw across from business, marketing, philosophy, education, all of these different fields to solve real world problems, and that's what I like to do.
Sounds amazing. It's always, when we talk about evidence-based and how we should trust evidence-based information and this pyramid of evidence, and it's so nice, but when we talk about biases and...
I mean, not all research is good research. Like, people listening to this, they may look at a news article that's based on a piece of scientific research. And one of the things that we need to do as public health people is to help people to evaluate what is good. Just because Dr so-and-so, like me, has written something, doesn't mean it's great. And so, again, we're back to our ABCs. We need to ask questions all the time. We need to believe nothing. We need to check everything from sources that we do trust. And then we also need to be critical. We need to be thinking, does that sound right? Does that sound right in my life and my experience as well?
Can we just, at the end of our conversation, if you see TikTok videos from Health Huddle, what should it be?
Okay, so I think an important message for us to get out is changing our health behaviours is really hard, because unhealthy behaviour is generally fun, enjoyable and easy for us to do. And so we need to be getting the message out that if people are able to make small changes that they can fit into their lives, they should celebrate those small changes, they should value them and really feel empowered and great about themselves because they've made a small change, because every small change we make is a step forward to yet another change. And so I think it's really important that we try and help people not to feel guilty about their health behaviours, who they are, how they act and how they react in situations, where we should be giving people the tools and also the confidence to say, yeah, I can do little bits, and little bits is a step in the right direction.
Great message. I hope it will be just the first our conversation, and we will have a lot of comments, questions and points for discussions. So thank you very much for coming, and
thanks for having
see
me.
you again.
If you want to hear more conversations like this, your support matters. Subscribe, leave a comment, share this episode and tell us what questions you'd love to explore. Together we can build a platform for smarter, kinder and more informed healthcare from the inside out. Let's huddle up!